What's up everybody? Welcome to the channel. In this video, I'm going to be teaching you the basics of foam rolling. More generally, this technique is called self-myofascial release. The basic technique is applying pressure to the body, perceiving where that pressure creates tenderness or pain, using that information to treat the right area of the body. After treatment, we retest and see if it had the outcome that we were looking for. In today's video, we're going to foam roll as if I was experiencing knee pain. And you can then apply this to your knee or your thigh, as well as other areas in your body. This video is the first part in a series I'm doing called Meat Suit 101. If you want to see more educational content that will help you be pain-free, hit the like and subscribe button down below. Now let's get rolling. Okay, so let's say you've got knee pain. You notice it maybe as you're bending into that knee, placing weight on that knee. Maybe you notice it when you're squatting a little bit too. So I just want to highlight some basic anatomy of the knee. In the front of the thigh, we've got the 4 quadriceps, which I'm highlighting in blue here. There's one other quadricep underneath that muscle here, highlighting it there. In addition, we've got a couple muscles that run along the inside of the thigh and across the knee, the sartorius and gracilis. You don't need to know any of this to treat it. We've got the hamstring group in the back, got the gastrocnemius below, got a couple small muscles behind the gastroc and just below the knee there. Then we have another muscle of the hamstring. So overall, just looking at the thigh, we've got the front, the back, and the top of the back of the thigh as places to treat. The first step, the first thing I would try and do is you grab your foam roller. Place the foam roller on the ground and get in a position where you're going to be able to apply your body weight through the targeted tissue into the foam roller. Here I'm getting set up where I can place, I kind of know where I need to place it. I'm placing it on the upper portion of my thigh. And as I'm rolling there, I'm kind of just exploring and looking for a really tender place. And as I explore, I find a particularly hot spot. Might be a 6, maybe a 7. But I'm going to roll into a spot just below the hot spot. A 6 or 7 is maybe too much. So I'm going to hit right where it feels like it's a 4 or 5. And then I'm going to wait. I'm going to breathe, kind of relax a little bit in my body, and focus my attention on where the pressure is, where I'm perceiving that pressure and that pain. After a few moments, this area will start to release. Then I'm going to roll back and forth again, and I'm going to check to see if that hot spot, which wasn't what I was directly on, has changed a bit. And in fact, it's changed, and now I'm going to place pressure directly on that hot spot. And again, I'm going to wait. Once I perceive a change, I'm going to roll, come all the way off the foam roller, and now I'm going to check. Did that release of that tissue make any change in my knee? If it did, which it looks like it did in this case, I'm good to go. Done foam rolling for now. Now that you're done with that short session of foam rolling, you're going to have one of probably 3 possible outcomes. 1, your knee might be better. 2, your knee is going to feel maybe the same. 3, maybe the knee feels a little bit worse. In the last scenario, that is if your knee feels a little bit worse, you're going to go ahead and take the foam roller and do the opposite side of your thigh. So let's say you were working on the thigh in the front, you're going to switch and do the back. Okay? And then if it's not any better, I want you to stay tuned for my video on the hip and the ankle, because it's likely there's a mobility restriction or a lack of activity in certain tissues of one of those areas that's causing your knee to kind of be the way it is. All right? See you next time.